Today I'm going to be talking about a C6 spinal cord injury, Asia B, or a sensory incomplete. This means that they will have sensory preserved below the level of C6 but will not have motor function below that level. So some of the muscles that they will have, or the actions that they can perform, are going to be shoulder flexion, internal and external rotation, extension. They will be able to do elbow flexion, wrist extension, and maybe some wrist flexion, depending on their injury. And they will have serratus anterior and lats. One big thing they will not have is their triceps to help with elbow extension. As you can see, I'm in an extension here. Their elbows likely will collapse without shoulder or elbow extension. So I will show some compensation tricks so that these patients can achieve long sitting without their elbows collapsing. These patients will likely need a little bit of assistance with bed mobility and transfers. They may be able to compensate and become independent to a certain degree, but likely will need at least mild assistance. The task I'm going to be performing today is supine to long sitting. I'm going to be showing a method where you anchor your arms prior to starting the movement. There are a couple other ways to do this, but the way I will be talking about is anchoring the hands first, getting to a supine on elbows position, and then from there you'll be throwing your arms out and getting into a long sitting position. First, what the patient should do, since they do have flexion of their elbows, and if you anchor your hands either under your pelvis through weight shifting, or if you have pockets, you can use pockets or a belt, you can do that. But some way you're going to anchor your hands, so I've got them under my pelvis here, and then you're going to, at the same time, you're going to 1, 2, 3, throw your head forward and use your biceps and your anterior deltoids to help hold that trunk, and hopefully it'll prop your elbows up into a supine elbows position. In this and in the video, the patient had the therapist behind them giving some assistance at the shoulders to help lift them up. Whether they were too weak for that or whatever, but the therapist can aid the patient from behind them or at their head. So on the count of 3, it's going to be, again, you're going to throw the head forward while flexing the biceps and anterior deltoids to pull that trunk up, and then you'll wiggle your elbows back until they're under you and you're on supine on elbows. So 1, 2, 3. And then from there, you want to weight shift side to side and get those elbows under you. From this position, what we're going to do, basically we're going to be weight shifting to one side, and you're going to use the muscles that are strong, so you're going to have your shoulder external rotators and extension, and you're going to quickly throw that arm into external rotation and extension. The fingers will be flexed due to wrist extension, but you're going to throw that arm back, and that's going to help lock that elbow out since there are not triceps. But again, it's going to be a quick external rotation and shoulder extension. I don't have a ton of shoulder extension. These patients will need lots of shoulder extension to achieve this position. But for this demonstration, I'm just going to be showing it as if I had a lot of shoulder extension. So again, you're going to externally rotate quick and throw that shoulder back, and that should help lock out that elbow with a lack. Using the anterior deltoids contraction, it's going to bring that elbow and really lock it out behind you. From this position, you're going to weight shift over onto my right, and I'm going to do the same thing with the left. I'm going to throw that arm into external rotation and extension. Once it's on the ground, the anterior deltoid is going to contract, which is going to cause elbow extension. So weight shift on this side and throw it back, and then flex the anterior deltoid and lock it out. From here, you can use your weight, or the weight of your head side to side, and flexing those shoulders, and it's going to bring you up into a nice long seated position. Some Some of the problems that the patient had with this task was their starting position and not using momentum. I don't know if it was weakness or just didn't know how to do it, but they started in a position where they were already kind of externally rotated. They didn't have their arms anchored, and therefore, and also didn't use their head for momentum, so they didn't really have a ton of ability to be able to flex their trunk. So they needed to rely heavily on the therapist picking them up from behind. Also, it looked like they were wearing some sort of sleeves that looked like they could be sliding on the table, making it hard to really get any traction and bring those shoulders up under, the elbows up under you. Another thing with their weight shifts, they didn't really use their head. Your head weighs enough that it helps with weight shifts. So I think one big thing that they could also do is, especially when they were on their elbows, use their head to weight shift to really properly weight shift and get on one side to be able to complete the task. Another thing, when they were on their elbows trying to get onto their hands, they started in this externally rotated position and relied heavily on the therapist to lift them, where they just kind of did that and the therapist fixed their positioning. So something that they should work on is really throwing that arm back, using the anterior deltoid to lock out that elbow before they weight shift and get their hands under them into the long sitting position. Some of the goals for these patients are going to be to strengthen the muscles that they do have. They're also going to want to increase their range of motion, especially into extension here. And then if they need any internal rotation, get into those initial positions. And then also just increase their understanding of how to set up themselves successfully to complete this task. The one I'm going to focus on mostly is going to be strengthening and range of motion, like I said. So one treatment would be to see if they even have the range of motion to get into these positions. So again, it's going to be internal rotation, palms down. So we want to see if they can get into that. If not, I think one intervention would be stretching it. Another one, like I said, is going to be the extension. So you're going to want to stretch them into extension, which is just going to help them achieve this position. With the range of motion, progression or regression can be just differing the ranges of motion that you're going in. More than likely, they're not going to have complete hyperextension range of motion from the get-go, so just working small ranges at a time, just trying to build up to that full hyperextension range of motion that they're going to need for the position. As far as strengthening goes, you really want to do the anterior delts and the bicep, because that's what's the anterior delt mostly to keep that elbow locked and then into extension, and then the anterior delts and the bicep as well to initiate that the first movement of bringing the trunk up to get onto those elbows. So one thing you can do for the biceps or anterior delt, bicep, just your normal curls. You can use a weight, you can use a band. Therapists can add resistance. Same for your anterior deltoid. You can apply resistance, kind of in different ways. And if they need to, you can get them into a gravity minimized position and start lower on the strengthening. And then again, you can add more weight, or you can have them, practicing going through some of the actual motions to start the task to increase that strength. Other treatments that I would focus on would be to do parts to whole training. So you're going to do small parts of this and kind of build up to the full thing. So maybe one day you're working on weight shifts while they're on their elbows to be able to fully weight bear, to be able to throw one arm back. You can also work on little pieces of it at a time. So maybe one day your focus is just getting from supine to supine on elbows. And then maybe one day you want to work on actually throwing the arm back. So the therapist may be behind them, giving as much support as needed if they're not able to complete the task themselves yet. But at least they are building up to it and getting more reps more repetitions and practice, that the full